Hi friends, Dr. Ramadevi Papalu here, fertility specialist. My center is located in Srinagar Colony near Panchagutta. The name of the center is IVF Assist. Today I am going to discuss in detail about the IVF. Many people think IVF is the last resort, but of late I feel IVF we should adopt, we should start this treatment a little early when compared to the olden days, because IVF with the lot of development in both in the lab techniques, embryologist and the gynecologist, and availability of drugs, media, keeping all these things in view, almost we are getting success rate around 60 to 70%. Whereas in 1975, when IVF came into existence, it was only 5%. But now almost it is reached a very good percentage. So if you want to get relief from fertility problem, to save the money and time, if you take IVF treatment, you are going to become pregnant in very fast. So I want to clear most of the doubts related to IVF. Many people think IVF means they need to take rest. You don't need to take rest. Whether the baby enters the uterus from the tubes or from down from the vagina, it is only the root change. Once it enters into the uterus and gets attached to the uterus, afterwards it is exactly equal to the natural pregnancy. So either delivery mode of delivery, like some people think after IVF every delivery has to be a cesarean section. No, it is just like normal delivery. Indications for cesarean section, for normal pregnancy conceived at home, and indications for cesarean section in IVF, both are same. So one should not worry about delivery will be cesarean. Another thing, because it is only the route we have changed. When you are traveling in on a road, if there is a block, if there is some traffic jam, you take diversion. Uterus, here also we are taking diversion. Instead of embryo reaching from fallopian tube to the uterus, we are putting the embryo from through vagina, through cervix. This is the only difference between natural pregnancy and IVF pregnancy. So, friends, I think you can understand both the procedures same, both the methods are same. Only route is changed. You need not take any rest. Normal, you can attend if you are working. You can attend office till almost expected date, or you can take 1 month or 2 months rest before expected date, because if you strain physically at that stage, it can end up in rupture of the membranes and premature delivery. Other things, many people have got doubts about the cost of IVF. Cost of IVF, it is like simply to explain to you, it is like a gold business. Some people say we don't take making charges. Some people say we don't take tarugu and all those things. But no one gives free. Everyone charges directly or indirectly the same. So don't get confused about the prices. Usually the price will be around 1.5 lakhs to 2 lakhs. It differs from patient to patient, because some people need more amount of medicine, because if their ovarian reserve is less, we need to give more injections. Some people need freezing. So if we do freezing, additional cost will be there. Some people need ICSI. If the sperm are not up to the mark, and if they can't fertilize the egg on their own, then we have to do a procedure, intracytoplasmic sperm injection. In this procedure, one egg, we can inject one sperm into each egg. So whenever there is a count, motility, morphology problems in a male, then we advise ICSI procedure. So if we need to do ICSI, additional cost will be there. If we need to do freezing, additional cost will be there. And if the ovarian reserve is less, then the medicine cost will increase. So it is like a tailor make. It is not a blanket, like it is not like TV. Suppose you are buying Sony TV, whether rich person is buying or poor person is buying, it is the same. But here, because the every couple's need is different from the other couple. So don't compare the prices with each other, and don't compare with the center to center, because no center will give you anything. None of the centers are charity hospitals. None of them get any money from anywhere else. For everything, because infertility is not included in the insurance, most of the time 99% patient has to pay. People try to attract, saying that we are doing cheap, we are doing this, we are doing that. So don't get into that. It depends upon each individual's necessity. So many people get scared of, will there be any side effects? I can discuss immediate side effects, long term side effects. Usually, immediate side effects, especially in case of PCOD patient. In PCOD, we categorize into mild, moderate, and severe. If severe PCOD is there, those people will produce more number of oocytes, and each oocyte produces 5 to 600 micrograms of estrogen. So if more number of follicles are developed, high estrogen will be there. In case of high estrogen, there will be some side effects that result into hyperstimulation syndrome. But I will not start a severe degree of PCOD directly. I will try to reduce the PCOD to moderate by giving medicines, or by doing laparoscopy and cauterizing the ovary. So, if I take all the precautions to prevent hyperstimulation syndrome, that immediate complication will not be there. And one more very rarely we come across is twisted ovarian cyst. If twisted ovarian cyst means when ovary is stimulated for multiple follicles, ovary size will increase like an orange size. So some people, it may get twisted, that may result into pain. But this is very rare. We caution the patient. We prevent this twisted ovarian cyst by making bowel movement free, and we try to avoid constipation. If there is a constipation, this possibility is more, but we take precaution beforehand. Even for the hyperstimulation, we know which kind of a patient is going to get this problem. So we take many precautionary steps. So because of the precaution pace, always prevention is better than cure. So because we take lot of precautions to prevent a hyperstimulation syndrome, in the last my experience, I never faced any serious problem because of the hyperstimulation. I never put the patient into danger. So these are the two immediate problems usually we come across with stimulation of the ovary. And long term, if the repeatedly we need to stimulate the ovary, then there is some amount of ovarian suppression, and there is a possibility of onset of menopause 2-3 years before the expected time. Suppose in naturally without IVF, if the person is going to get menopause by 45 years, this may occur around 42 to 43 years. This is the only long-term side effect. So other than this, there will not be any side effects because of the IVF.
Doctor, we can see the thyroid cancer, the thyroid cases are also increasing day by day. So actually, what is thyroid cancer, doctor?
There is a endocrine organ thyroid situated in front of the neck, which